Second session of recently asked question in examination, we will talk about clinical cases and the examples. This is the first example. You can see the stem of the question, the marks distribution, and the number of questions that can be extracted out of this clinical case. This is a case of diabetes mellitus. You can see the questions that are being asked. Next one, it is a case of iron deficiency anemia. You can see the questions and the marks distribution. Now this one, it is the case of obstructive jaundice. You can see the marks distribution and the types of questions that are being asked. This is about shock. You can read it out. You can understand this. Diagnosis, marks distribution, and the type of questions that are extracted out of this clinical case. A 60-year-old man complaining about this. It is a case of Parkinsonism. You can read it out. You can see the marks distribution and you can see the type of questions. Now this case, it is about shock. Again, you can see the marks distribution, read out the question and answer the questions. Now this question, it is about metabolic acidosis. You can see the marks distribution and the questions that are being asked. Now this is a case of chronic obstructive pulmonary disease. Okay. You can see the marks distribution and you can see these questions. Now this is a case about sickle cell anemia. Okay. You can see the marks distribution and the questions. Now this case, it is about obstructive diseases. It is from pulmonary physiology. You can see the stem of the question and the marks distribution and the questions that needs to be answered. This one again from the respiratory physiology. It explains hyaline membrane disease. You can see the questions here. This question is from cardiovascular system, and after reading it, I can make out it is about myocardial infarction. You can see the questions, you can see the marks distribution as well. Thank you very much. In the next session, we will be coming up with the short notes. We'll be covering short notes. Thank you.